Thanks so much, Shavante. Thanks to PJI, thanks to the Annie Casey Foundation, and thanks to all of you for being here. We hope you're staying safe and healthy. Today is a follow-up from a webinar a couple of weeks ago where Nate Bayless announced the Casey Foundation had convened a series of teams to focus on specific issues related to youth justice in the wake of the COVID-19 pandemic. Shavante and I have the good fortune of being part of a team dedicated to examining how to best promote the safety and well-being of youth who are still in custody during this challenging time. This webinar is the first in a series of convenings and resources we'll be releasing, and we want to acknowledge the hard work of our team members, including our panelists today, who I'll introduce in a moment, but also Gail D. Mumford and Tanya Washington of the Casey Foundation, Doug Keeler, Executive Director of Juvenile Justice Advocates International, and R.J. Binning of the Casey Foundation's Youth Advisory Council, all of whom have been instrumental in helping us work as a team to get content out to all of you in the network. It also includes my colleague, Jenny Lutz from CCLP, who's going to help moderate the discussion with our panelists today. And I'm really hoping my 4-year-old son won't also try to moderate, but no promises. You can see our purpose statement for the Youth of Custody group up on the screen, and while we'll talk more about that, we want to be clear that we're first and foremost encouraging folks to safely release as many youth as possible, as quickly as possible, and to safely prevent new admissions to facilities during this time. There was a great webinar last week from the release and case processing team, if you haven't checked that out, but we wanted to emphasize that while we're talking about youth and staff currently in facilities, the bulk of our work collectively as youth justice professionals should be doing the things we need to do to safely prevent the need for confinement in the first place. That said, we know in many places some youth will remain in custody, and we know that youth of color are overrepresented among that group. The trauma, stress, and anxiety associated with being in custody or in contact with the system during the pandemic has a major impact on youth and families, and we know youth of color are disproportionately bearing the brunt of that. This is a time when those youth and families need our support more than ever. We also recognize that staff are confronting challenges created by the pandemic and are under enormous stress too, which has a negative impact on them and their families, and it also impacts their ability to care for young people. I'm sure you've seen the many stories about the fact that so many of our essential workers in this country are people of color, which means they're being exposed to the coronavirus as part of their jobs and don't have the benefit of working from home like so many of us do. This is undoubtedly part of why communities of color are being devastated by the effects of the pandemic in more significant and tragic ways, but it's obviously a product of and entwined with this country's history of structural and systemic racism. While there's a lot to be worried about, this time has also been an opportunity for JDAI jurisdictions to think outside the box and come up with creative strategies to address problems created during the COVID-19 pandemic. Today, we will have what will be hopefully a series of conversations about specific strategies and innovations that sites have used to support youth in custody, as well as staff. On the next slide, you'll see today that we'll focus on 4 areas today: admissions, access to families and loved ones, connections and connections to programming, and staff well-being. We're going to hear from 2 amazing youth justice professionals about what's worked for them in response to the COVID-19 crisis in each of these 4 areas, as well as their strategies to maintain some of these innovations beyond the pandemic. There are no shortage of recommendations from organizations about what should be done in facilities at this time. Some of you may have seen that the American Association of Pediatrics just released its statement on youth justice and the pandemic earlier today. But the focus of this webinar really is to hear more in depth and from the front lines how your peers have been thinking about and navigating the COVID-19 pandemic. As Shavante said, we encourage folks to write in the chat examples of what your sites are doing to support youth and staff during these times. We're going to be compiling these and sharing these with the network and other youth justice professionals, and we want to be putting out practical, concrete, and helpful guidance and lift up the good work that many of you are doing in your jurisdictions. And as Shavante mentioned, we'll be taking questions in the Q&A. We have time dedicated at the end of the webinar for that. So please, as you're hearing the panelists talk about their work, don't be shy about entering those questions into the Q&A box. So with that, I'm going to turn to introduce our fabulous panelists today. First is Angie Lopez, who's the JDAI coordinator in Pima County, Arizona, which is home to the great city of Tucson. Angie has over 15 years of experience working in the juvenile justice field, with most of those years concentrated in various aspects of system reform work. Her previous roles include auditing juvenile detention facilities across Arizona, co-managing the Arizona JDAI state-scale efforts, and working directly with youth in secure care. Angie's passionate about working collaboratively to better serve youth and families. She's a proud mother who loves the outdoors and a graduate from the University of Arizona. And then we also have with us Tony Celestine, who's the Assistant Director for the Calcasieu Parish Office of Juvenile Justice Services. Before being named Assistant Director in April of 2014, Tony was the agency's detention manager and was responsible for all detention operations, including medical, mental health, shelter care contracting, alternatives to detention, maintenance, and food services. He also played a huge role both within his agency and the state in developing and implementing statewide detention standards as the president of the Louisiana Juvenile Detention Association. Tony's committed to providing equitable opportunities for children and families in both Calcasieu Parish and the state of Louisiana with the goal of achieving healthy outcomes. By promoting systemic reform initiatives through various partnerships, he's embracing his role in ensuring all children in Calcasieu Parish have the opportunity to live happy, healthy, and successful lives as they move into adulthood. Tony's a graduate of McNeese State University with a concentration in criminal justice and sociology. He's a proud husband and father and a diehard Dallas Cowboys fan. Angie and Tony, it's so good to see you, and thanks for taking the time to share your insights today. We're going to kick it off with our first question for you guys, and then my colleague Jenny is going to help moderate the discussion up until we get to our Q&A. So we know that today's webinar is focused on youth in custody, and that obviously begins with admissions, but we know that our focus, as I said earlier, needs to continue to be on safely releasing youth and preventing as many youth from entering detention as possible. Can you give us a sense of what your jurisdictions have done to reduce admissions and release youth, and tell us about some of the precautions you're taking for the youth who are being taken into detention at this time?
So thanks, Jason. Thanks for the lovely introduction. And Angie and I are going to do our best to definitely connect with you all in terms of some of the strategies that we were able to put in place in response to this COVID crisis. Here in Louisiana, I think we took a very proactive approach here in Southwest Louisiana to the pandemic. Early in March, myself and my director, Bill Summers, took a very active approach in connecting with our crisis response team here in Calcasieu Parish, as well as our other parish officials and state officials. We didn't simply wait for the governor to say, hey, this is the stay-at-home order, and react. We hit the ground running. You know, we were boots to the ground, looking at our policies and our practices and seeing how we could make these necessary changes to our systems and connecting with our system partners. Our primary focus at hand was detention utilization and conditions of our facility, conditions that the kids would be living in and residing in the midst of the coronavirus pandemic. So we really, drilled down on some of the things that we were doing, and we looked at it in terms of 3 criteria, and that is admission criteria, pre-screening, and medical and mental health screenings. So, one of the first things we did was connect with our community partners and law enforcement agencies as it relates to the COVID-19 criteria and protocols that we were going to be implementing in terms of changes to our natural policies. We made sure that everybody was abreast of who would be accepted into detention, who could be presented to detention, and what would be some additional alternatives. The data shows that in early March, many detention centers across the country reduced their numbers at a tremendous rate, and kids were being released back into their home environments. Although that was happening, there were still certain jurisdictions that were still detaining kids, and we know some kids present risk, so they're presented to detention. But we felt it very necessary to show the things that we were doing in terms of being very transparent with our system partners, which included law enforcement, our judicial partners, the prosecutors, public defenders, as well as conflict attorneys within our areas, along with advocacy groups. We did that on the front end just to get the message out as to what we were going to be doing. Now, in terms of pre-screening, we've always used the detention risk instrument, which we made some addendums to that in the midst of this coronavirus pandemic, and that is simply this. A kid could be presented for detention if the kid had no public safety risk, they were flat out released. They didn't even come to the front door of our detention center. If a kid had a public safety risk but showed symptoms of possibly testing positive for the coronavirus disease, then we had that child medically cleared before they could be presented back to us. If there was no concerns in reference to the child's health issues, that child was then admitted into the detention center with no concerns. Now, every kid that was presented to our facility, we asked them a series of screening questions about their whereabouts over the last month, how they've been feeling medically, did they have any cough, any runny noses, any symptoms that might be related to the flu. And we also did temperature checks. If a child had a temperature above 100 degrees, we asked that that child be medically cleared before being brought back to our detention center. And that's what happens when you have a good relationship with your law enforcement professionals in the area. If a child's presented and at the last minute you find that there are some health issues, it's a good thing that they're willing to take that child back out to a community medical agency, hospital, or urgent care facility to have them cleared. If that child comes back and there was no signs of any, flu symptoms or anything connected to COVID, we then, detain them. One strategy that we put in place is that every kid that's presented to our facility for detention, while they're still in the Sallyport area, we want to make sure that they're receiving the appropriate PPE. So all the kids are given masks. Our detention staff members are wearing masks while they're connecting with the youth and law enforcement officials while we're doing the transfer of custody of that child. Once we take custody of the kid or the child, we're working in accordance with our statewide detention standards, and that is to assure that a brief medical assessment is done, a medical screen is done, and that child is placed under some form of medical isolation, no different than we would do in normal times. This is not a form of punishment. I know with the heightened stress that our detention staff and folks are going through, we want to make sure that the child is safe. So they're getting the necessary medical treatment that is necessary. We're still connecting with our medical professionals 5 days a week. Monday through Friday, they are coming out to see our kids and clearing them face to face. And on the days that they're not at the agency, that they're available by phone and by virtual means. We want to make sure that we're providing kids in Calcasieu Parish with the necessary help and protocols that are necessary for them to feel comfortable and safe while they're in our facility. So we're doing things such as making sure that the facility is sanitized multiple times a day. Things are disinfected. Common places where we're touching things, they're wiped down and sanitized throughout the day. We have hand sanitizer stations throughout the facility, and the youth and the staff, if necessary, are provided with additional PPE, which is masks, gloves, and things that would assist them in making sure that they can have a safe stay while they're in our facility. These are just some of the front end things that we're doing and things that we're doing on our housing unit and in our common areas throughout the day to ensure that safety protocols are being met. We're also looking at those kids that are presented to us at the center but may not meet the criteria to be detained. These are kids that might be released back into the community. So we're assuring that we're doing our due diligence and assisting them as well. So if a kid is brought to our detention center and they don't meet criteria through our detention screening instrument, we're making sure that plans to ensure that youth is returned home to a safe environment where all his necessary supports are there and that he or she can thrive with the necessary means that that one would need to be safe in the midst of this pandemic. So we've partnered with different community providers to donate masks. We purchase additional masks, and we want to send kids home with a limited supply of PPE, which we will send them home with a mask or hand sanitizer if necessary. And then we want to connect with our community collaborations, our community partners, to give families resources that might be available to them within the community. such as places like the United Way, advocacy groups, intergovernmental agencies that might be able to assist them with the appropriate resources, as well as the appropriate protective equipment that they might need, things that we cannot do. We're also wanting to make sure that they have adequate access to food and shelter. So we're connecting with community food banks and food pantries, giving families resources that they might need to connect with those providers within the community. We're also sharing information with various school districts that are providing school feeding programs to school-age children, kids from pre-K on up to the 12th grade. There's several locations within our city here in Calcasieu Parish, which our main city is Lake Charles, Louisiana. The Calcasieu Parish school system has various locations where kids can go and receive breakfast or lunch Monday through Friday, which will reduce the burden on their parents who might be strapped financially, or those parents that have to work but cannot, provide adequate food for their kids while they're at work. So everybody's partnering together to try their best to make sure that our children, our school-age population, have the necessary things that they need to thrive in the community. Angie, I'm going to turn it over to you to see if there's anything that you have different that I might have missed or didn't capture. I know we had conversations and there's a lot of similarities in our jurisdictions, but I'm going to forward it over to Angie and let her continue the conversation.
Thank you so much, my friend, and thank you all for being here today. It's truly an honor to share what we're doing. We certainly don't have it all figured out. I don't think any of us are doing things perfectly, but I just think this is such an amazing opportunity to share examples, and I look forward to hearing from all of you that are on the webinar as well as far as what you guys are doing. So just a little
Angie, could I jump in for just 1 minute and just ask you to, and maybe Tony to weigh in on the size of your facility in terms of beds, as well as your kind of the rough county population that you have in your area?
Okay, no problem. I have a small facility. We have a 36-bed facility. We're actually in the midst of, we're in a big construction project on a new facility, and we're only increasing by 2 beds. Our population is somewhat hovering somewhere around 200,000 in Calcasieu Parish. So we're a small metropolitan area, but, we're growing in the midst of a huge economic boom.
So here in Tucson, Arizona, we're home to over 1 million people. We're actually the second largest county, Pima County is, in Arizona. We have an over 300-bed facility, which we will never fill up. That's a huge commitment of ours. Prior to COVID, our population was a little higher than we wanted it to be, but we were sitting early March about 61. We've experienced a 54% reduction. As of today, we have 28 kids in that facility. So we've done a lot of work. Pima County is actually the first JDAI site in Arizona, so we've done a lot of work since 2004 along the way. And I say we, but I inherited this amazing foundation that so many people built before me to really get us where we're at. But I just echo Tony's comments, and I appreciate him so much. I've learned so much from him, and we've taken so many of his examples along the way. And so much of these examples kind of mirror one another. So I'll kind of just add in the things that might be a little bit different. Our responses here really have been rooted in collaboration. Like I mentioned, the JDI efforts have been going on for quite a long time here. So our leadership, the leadership of the courts, have been having weekly phone calls with partner agencies, and those have been standing meetings for quite some time. So early on, there really was an intentional effort to respond immediately, as Tony mentioned, to reach out to those partners and figure out how we could work together. So there was efforts initially talking to law enforcement, county attorney's office, DCS, our tribal communities, defense counsel, about limiting the amount of youth coming in, and then how can we expedite the release of the youth that we have in the facility. Also, there's been additional reviews of in-custody cases by our judicial officers. Our judges are looking at cases. Our probation staff are looking at cases. I've been looking at cases. Everybody just trying to put extra eyes to see how we can expedite the release of kids. And I'll be completely honest and transparent, that can be challenging. A lot of kids are waiting placement, and there are barriers in getting kids out as quickly as we would like, but we've all really been working together. In terms of the kids that do come in, similar screening process to what Tony described. We are screening kids, medical staff. We really have the luxury here of having in-house medical and mental health staff. So our medical staff is meeting law enforcement outside of the building, screening kids there with the COVID screening, taking temperatures right then and there. All of our detention staff or anybody inside of detention is wearing masks. We have implemented an intake unit and a medical ISO unit if we need to. I'm happy to say we have no positive cases for COVID at this time. So some of what, and I think I saw it pop up in the question of what additional steps are like medical staff taking. Our medical staff are checking temperatures every 2 to 4 hours. We recognize these are very difficult times for kids in detention, very isolating, because we're not allowing in-person visitation, which we'll get to a little bit later. So our medical and mental health staff are doing additional checks. Mental health staff is checking in, seeing how kids are doing. Also, in terms of kids that we're releasing, there's an ongoing effort right now, and I credit this to just the national conversations going on around how we ensure that kids being released from custody and their families have what they need. So there's actually, here we have amazing community partners that have just done a great job with continuing the sharing of resources and information, and that's kind of my role, is to pass that all along to our probation staff, who also play a crucial role. They're connecting with families and kids and finding out what kids need, so we really thank our POs for all they do. But the drive that's underway right now is a collection of PPE and hygiene items that will be collected and then distributed to youth released from detention and youth going through our reception center known as ACEs, and also for opportunity youth in our community. So kind of what that looks like if people are looking for actual steps is a couple of our community organizations partnered together along with our Network for Equity and Education Development, and that really is our standing committee that's looking at disparities for African American youth. So that group partnered with United Way and Youth on the Rise and all of their community connections to start a drive. We created a wish list. We put that out and the response was immediate. And so right now we are accepting donations at a youth drop-in center known as Goodwill Metro here in Tucson. So we're collecting all those items. We have volunteers on standby that will be sorting them, and then they will be distributed, like I mentioned, to us here at the Juvenile Court, and then also to our partners at Goodwill Metro to be distributed to opportunity youth in our community. And really, there's an intentional focus to make sure that we are able to individualize those items so that detention staff, probation staff are working with families and young people as they're being released from custody saying, what is it that your family needs? What do you guys have, so we can customize those kits to make sure that we're meeting needs. Also, we've increased sanitation practices, like Tony mentioned. Our faith-based partners have played a huge role in that drive to collect items for young people and families. And I think that might be it on this piece. I want to leave room for the other sections, unless I missed anything, Tony.
No, I think you're on point, and
Okay.
I want to go ahead and echo Angie's sentiments. At this point in time, we have no confirmed cases of coronavirus in our detention facility with our staff as well as the kids that were here. And I think Earl Ross posed a great question a minute ago in the chat, is what happens to a child if they show symptoms and they're screened? Obviously, that child would not be brought back to detention. That child would obviously be quarantined in a local hospital or medical facility to address their needs. So I thought that was a great question. Thanks, Earl.
And this is Jenny. I'm going to kind of move us along to the next section. Angie, you mentioned, that you acknowledged how difficult it is given the lack of in-person family visitation. And we know one of the big concerns that folks have is making sure kids aren't cut off from, family members and other supportive individuals. On the other hand, we also know that there's limited access to technology and other resources for things like video visitation in certain rural areas, communities of color, other places that have experienced decades of underinvestment in infrastructure. So can you tell us a little bit, both of you, how you are navigating the challenges of keeping youth connected to their loved ones, youth who are in custody, connected to their loved ones outside the facilities?
Certainly, Jenny, thank you. So Definitely a challenge right away. Like we mentioned earlier, in-person visitation was put on hold very early on, but we definitely recognize the importance of maintaining connections with family members and positive supports. We did not already have virtual visitation. It was something that was actually in the process, and we were already working on that. So immediately what we put in place was we asked detention officers, probation officers, we're still allowing professional visitors. When probation officers are going back and visiting youth in detention, we were asking them to make additional calls. Detention officers were doing that as well. We also had probation officers doing very creative things and using their department phone to make video calls. We've since repurposed a department phone and put Google Duo on there, which is really compatible with either Android or iPhones, and have that available to be checked out. We keep it in the control room so that when probation and surveillance staff go back to give youth calls, they can check that out and they can use it for video calling. It's not a perfect system because there are a lot of barriers being in that building making service work, right? So calls get dropped. So we've actually reallocated some dollars for some projects that were underway, but because of COVID are not really going to happen the way we thought they were. So we've reallocated some dollars to buy some laptops that will be for visitation, video visitation permanently back in detention. So we're happy about that, but we're making the best of what we can right now. And we really credit our staff for doing everything they can, recognizing early on, even before we got things in place, that they needed to step up and get kids connected. Additionally, like I said, we're still allowing professional visitors, but we're requiring them to wear masks when they meet with young people. There's been a lot, and I will say early on at the local and state level, our judges, we appreciate everything they did and just responding quickly and immediately and getting information out to all of us about how things were going to change in terms of making sure that we protect the public, but also that there's access to justice. So changing a lot of our hearings to telephonic hearings. There were some guidance provided at the state level, and that's been updated a couple times from the Arizona Supreme Court, but it really allowed flexibility for our local courts to kind of do what they needed to do to run things. So in addition to telephonic court hearings, we also have, so the only in-person hearings that we're doing right now are for in-custody cases, some dependency cases, but everything else is telephonic. We've modified education practices. I wish we could say that we're doing virtual education, but at this time our teachers are making packets, so they're kind of doing the best what they can. And then our detention staff, one of the many hats they wear is helping kids work through those packets. So they're helping kids work through the packets, and then on a weekly basis, our teachers are picking those up and working through them. And this really is a time, and we'll kind of transition through this in the next section, but that we've asked our detention staff, and they already did a lot here. It was already the culture that they had young people out of their rooms and were interacting, but it's really a time to even build those rapport, an opportunity to deepen that rapport building, because we're really relying on them to help young people get through this time. And I'll turn it over to Tony, and I know that he had quite a bit to add in this section.
Thank you, Angie. And we too, just as Angie mentioned, made some quick adjustments to our protocols, our processes, and developed some new practices through innovative strategies. We felt it was very necessary to be transparent with our families within the community. So one of the first things we did was communicate with our families, providers, staff attorneys, and folks that we typically work with on a day-to-day basis, and inform them of the temporary suspension of face-to-face visits. Now, we had our detention staff, which included our detention director and shift supervisors and assistant shift supervisors, communicate with the families of each child that was detained in the facility at the time that the stay-at-home order went into effect, which in Louisiana, it went into effect back on March 16th of 2020. So what we did was we reached out to families. We know most families don't have an actual landline home phone, so everybody has a cell phone. So we reached out to find out, whether they had an Android or an iPhone, and got that information, and immediately lined up some iPads, computers, as well as phones to have our children connect with their families on a day-to-day basis. So in reaching out to their family members, we wanted to do something else, and that is broaden the definition of what family means. everybody doesn't live in a home with, two parents or one parent or a biological parent and a step parent. Their definition of family differs. So we wanted to find out who was the contact person that a child could communicate with, and we were given that information by their probation officers and or anybody else that was working hand in hand with the child and their family. So once we broadened the definition of what family is, we wanted to make sure that we gave them ample amount of time to connect with their parents or their family members on a day-to-day basis. So they get to connect with their families twice a day through video means, once in the morning and in the evening, and then they also get a chance to make a phone call to their family members every evening. So we're trying to give them as much access to their families as possible. And those of you that have worked in detention settings really understand the statement I'm getting ready to make, as if you can give a kid ample opportunities to connect with their loved ones, you're going to reduce the issue or the opportunities of de-escalating a problem later on during that day. The more connections they have, the easier it is for them to maneuver through day-to-day operations. We too are still allowing our probation staff to connect with the kids. They're doing that through virtual means as well. Attorneys, judicial partners, they're all connecting with the kids through virtual means, whether it's Zoom, FaceTime, Google Duo, Skype, WebEx, whatever whatever virtual platform they have available to them. We're trying to push that. We're just really trying to make access a norm for these kids. Access has always been a norm, but these virtual means are giving us quite a bit of strategies that to sustain after this pandemic is over, to open up our facility even more to our community partners and families to communicate with the kids. We're really trying to assure that their legal rights are not being violated in the midst of this pandemic. The virtual visitations are still taking place, but we're making sure that, we're not utilizing, any form of unnecessary room isolations or confinement. We want to keep staff and kids actively engaged throughout the day. So that's something that we've been able to do through promoting strong programming. And we also, really are paying close attention to preserving the health and wellness of our kids and our staff. We're practicing the social and physical distance guidelines, and we're making sure that continuous sanitation is going on through any type of programming or any type of connection that we're having. In terms of education, our education services have been modified as well. For a while, our school district was trying to figure out just how they would educate kids. But now, as a matter of fact, starting on yesterday, we have 3 school teachers, and all 3 teachers will have virtual office hours through their Blackboard website, and they're delivering packages for kids to complete their work twice a week. Once the kids complete the paperwork, the coordinator of the hospital homebound program will come and pick those documents up and get it to the teachers so they can grade. And this will continue to happen throughout the month to assure that kids are getting an opportunity to be educated while they're in the facility. Also, court hearings. Angie mentioned that as well. Guys, if I can lift up anything, or if there's one thing I've really realized quickly, is that if you give people tools, they will utilize them. Our juvenile court judges here in Calcasieu Parish love the virtual court hearing process. There's complete buy-in from the judges. There's buy-in from the prosecutors, the public defenders, even the retained attorneys that we've worked with. The kids like it. It reduces stress of getting kids, from the detention center to the court building, and parents are not complaining. I really feel like this has been a great tool, and I spoke with my director, Bill Summers, earlier, and there's one judge that has already committed to sustaining this practice after the pandemic is over. We host virtual court hearings Monday, Wednesdays, and Fridays. And if there's an emergency need, then we have the opportunity and the capabilities of hosting those on Tuesdays and Thursdays if the need arises. So there's been great buy-in. Most of our partners have now purchased their own Zoom accounts or their own WebEx or Teams accounts because they like it now. So they're hosting meetings, they're inviting us to meetings through these platforms as well. So I really feel like one of the big challenges where folks were hesitant of technology, and once you get involved with it, it's very easy to utilize. So these are some of the things that we've uplifted to create access, and that is through virtual means, telephonic means. We're not limiting anybody. As if there's a therapist or a mental health professional that needs to connect with the child, they also have the right to connect with that child virtually or through telephonic means. So we're just really excited about some of these things that we were able to implement very, very quickly. As I stated earlier, we didn't wait. We just jumped in and act. We all have our policies and procedures, but every now and again, through adaptive measures, we have to uplift practices. So, the processes and the policies are there, but you got to drop those practices in when you're in the midst of a crisis or a high stress event.
And so this is Jenny. I think you guys have kind of already talked about this a bit, and it's great to hear how much you're being creative and trying to provide some normalcy for kids in terms of accessing connections outside the facilities. We know that life has really been upended for a lot of us. And so how have you all been able to use some of that same technology and creativity to ensure that kids who are detained, are engaged and participating in programming and things that they normally would during COVID?
Oh, it's a great question, Jen. And just like anything else, sustaining program is the lifeline to your secure detention facility. Maintaining a level of diversity in programming, sometimes it's difficult when, organized and non-essential program staff are restricted from entering your facility. So, Angie and I both uplifted the same statements that all of our program basically is staff-led. So if programs and services are being staff-led, we have to assure as directors and those that are running departments that staff have the necessary resources to put on effective programming. This also gives us an opportunity to see those staff members that have great creativity, those up-and-coming leaders that are out there grinding and pushing hard. So we have to allow time for new programming innovation. Anything that we do, we always want to assure that, we'll be interested in this program under two conditions. If safety is there and that we're keeping social distancing guidelines in mind. Other than that, if it's something that's doable and it fits within the time parameters, we're lifting it up. We're allowing our staff to go out and do it. And I will, gladly tell you, our detention staff here in Calcasieu Parish, they stepped up, they've taken on the challenge, and they're doing great. Some programming ideas that we've moved to somewhat of a virtual setting, and some are still face-to-face as recreation. We have to still provide some type of group movement, where kids can get their blood flowing. We're doing that. We're just reducing the number of kids that will participate in those groups. If there's a team sport, we're reducing the number of kids that are participating with that. And if there's anything that we can do to assure that it's a non-contact activity, we're also doing that. Church services being done virtually. We had several denominations that were coming in providing moral and ethical training for our kids in our facilities. So that's been moved to a virtual setting. Group therapy can be done virtually, but we have an amazing clinician, guy by the name of Chase Walling, that's doing groups Monday through Friday, face-to-face with our kids in detention. I don't know how he's spreading himself, but he's getting it done, and we're really appreciative of it. We're still doing our video games where kids are, playing together, but, with the 6 feet barrier there are still books to be checked out through the library, lifting up art therapy. And we have a small facility, and we're short-term secure facilities, so level systems have never worked for us, and we've cut those out a long time ago. So we really feel that it's important to lift up and sustain your incentive programs. Our kids have the opportunity to connect to daily incentives and weekly incentives for good behavior. And this is of huge importance to the kids in the facility. So we got to continue that. And I would encourage any administrators out there that if you're not looking at some form of incentive-based structure for your kids in detention, you're missing a great opportunity to connect with them on many levels. We have a pet therapy program where we work with our animal services department for Calcasieu Parish. It's been on the lull, but you know, there's talk about getting that jump started again, where we take dogs that are rescued or abused, and we work with personal trainers where our kids get a chance to teach the dog basic obedience, and they love their program. We love it. The kids like it. So this is something that we're in early talks to get started again once animal service is up and running. You know, we just really want to make sure that we're meeting their needs. And the more we can keep them engaged and out of their rooms, the better things are going to be for everybody. They now understand what it means to social distance. They understand to go to, you know, how to go to the different stations and sanitize their hands. They know the things they need to do in order to make sure that they're still allowed to participate in programming. Angie, I know we had conversations earlier, and I think we are doing some of the same things. So I don't want to miss the opportunity to give you a chance to talk about some of the great things that's being done in Pima County.
Thanks, Tony. So yes, we have a lot of the same programming prior to COVID that Tony described. Right now, all of our outside programming has been temporarily suspended. So really our detention staff are just picking it up and being extra creative. It was already one of their roles to be a mentor. They're assigned youth to mentor as they come in, and if those youth come back, they have the same mentor. We try to have consistency with that. So additional work for them, just connecting and checking in on kids. We also have binders inside of, we have control rooms where we use them now as supervisor offices connected to each living unit. And inside those, we have binders with resources for staff-led programming. So these are things that are ready to go that detention staff can use to lead programming. The design of our facility also gives us an advantage of having recreation areas connected to the living units. So our detention staff lead recreation time that is still ongoing. We have a Pima County library in our detention facility, which is amazing, and that's still going, so kids still have access to library books. And just acknowledging that there's additional stress on our staff and kids, and doing more frequent check-ins with both. Providing, I know that our detention staff are providing information about current events. Kids are coming in at different times, so they know what's going on, and they're having conversations. So just having conversations, sharing facts, answering questions, making sure people are feeling comfortable. And I think everything else is probably pretty in line with what Tony said.
And so I just want to make sure that we get to one last really important component or topic that we were going to address. I know there are a lot of questions on specific programming aspects and incentives, and we can, get to those and respond to those later. But, as Jason mentioned, we wanted to include staff in this webinar as well, and what facilities are doing to support staff wellness. Also acknowledging there's a racial equity issue there in terms of who are essential staff and who's on the workforce in facilities. So can you all talk a little bit about what steps you've taken to make sure that staff who are responsible for caring for youth in facilities are protected and supported during this time, and maybe what some of the peers on the call should be thinking about doing in their jurisdictions?
Certainly. And I wanted to mention too that, and Tony mentioned it, we also have a very broad definition of family. So who the probation staff allow youth to call, that's very individualized, and who are their positive supports. We've been doing that for some time, so I just want to make sure I mention that. In terms of staff wellness, I credit our leadership for really trying to be creative with limited resources, doing frequent check-ins, supervisors in both probation and detention, checking in on people, seeing how people are doing. We took an example from Tony about premium pay. We have a little bit of different version of that, but we have premium pay for detention staff and other essential staff that are working directly with youth or with the public. And so that premium pay is $2 extra an hour for us. Also, we've implemented COVID leave. So there's 2 weeks of additional pandemic leave for people that need that. Our supervisors have been very flexible about understanding the needs of people. We telecommute some days, both for those of us that can, not our essential staff back in detention, but for probation and my role, we telecommute some days, and our supervisors and leadership have been really understanding about that people are also homeschooling and have all these other things going on. So just the flexibility and working with people and checking in. I think those are the pieces that we have that differ from Tony, so I'll let him talk about what they're doing as well.
Okay, thanks, Angie. Here in Calcasieu, we're doing some of the same things. We really were able to pare down to who is non-essential staff and who are essential staff. So in terms of making those distinctions, non-essential staff were sent home. They were sent home with pay. So these are folks that are actually at home. And, you know, if we were not in the midst of a pandemic, they would be at work. So it's not fair to them that they are not paid. So they're at home with pay. With those staff, we're doing weekly check-in to sustain connections and updates. You know, we want to always make sure that they are kept abreast of new changes of parish policies. Our parish government officials were very proactive and liberal in terms of blessing staff with pay. So, you know, we feel it necessary to keep them informed, to know what's going on and when we may be phasing back into work. And we also feel like these staff welfare checks are important, you know, for connection. You know, folks really don't care about how much you know until they know that you care about them. So we're able to make sure we're keeping those connections with them. Now, the essential staff are working on site with hazard pay and are working from home with hazard pay. Now, what hazard pay means here in Calcasieu Parish, and this has been going on since March 16th of 2020, hazard pay means double time and a half for all detention staff members and all MARC Assessment Center staff. If you're working, you're getting paid double time and a half. Now, us in administration, it doesn't apply to us. We were getting, you know, our straight pay and an additional pay for a while, but that's over for us. But whether I got it or not, it was important that our detention staff who are out there being resilient and working hard to make sure that kids are being well cared for and keeping our facilities sanitized and safe, we're getting an extra added financial incentive for working hard. They are the lifeline of our agency, and we are so appreciative of them. We're definitely lifting up them through their hard work and efforts. There's an enormous amount of stress and pressure that's put on them on a day-to-day basis to manage facility operations and help to ensure that, you know, safety, health, and wellness is entrusted, you know, on a day-to-day basis. So we are really proud of them standing up in the midst of these emergency protocols in response to COVID-19. And they have been very proactive in giving us additional strategies to make things better. A lot of their footprint is on a lot of changes that were made within our policies and procedures, those things that we now are dubbing as COVID practices, that some of them we hope to sustain. And I give credit, a lot of that to our detention staff, a lot of that to our governing officials, a lot of that to our director, Bill Summers, who is, you know, this guy is great. He's doing an awesome job supporting our community, supporting our kids, and making sure that those connections with families and community and providers are there, you know, and that's transcended throughout our agency, from Bill to myself to our department managers, and specifically to our detention staff and our MARC staff. So we're really excited for them. We're excited to continue to pay our staff hazard pay as long as this stay-at-home order is there, but also to connect with them on a weekly basis. And not just our detention staff, but we're connecting with our probation staff and all our ancillary service staffs that are at home. So that connection is there, and lifting that up is important because the vast majority of our staff that works in detention are people of color. At our Mark Center, it varies. It's not quite half and half, but in detention, the vast majority of our staff are people of color, and we know that COVID has no respect of person, but we want to assure that there's equity there for our people, our staff of color, and all of our staff, not just them, but we want to definitely pay close attention to the special circumstances that are wrapped around folk of color. So these are some of the things that we're doing here in Calcasieu. We're excited that we took a proactive approach around all 4 buckets of our discussion today, and we are really looking forward to sustaining a lot of these practices, and we are available to communicate with anybody to share some of our thought processes as to the reasons why we moved on and made some of these changes to our policies.
All right. Thank you, Tony and Angie, for sharing what you've been doing in your sites and just really giving us some really creative and innovative strategies. We really appreciate it. We know that there are a lot of questions coming in the Q&A, and we really do want to make sure that we respond to those. As we talked about in the beginning, we have a team of folks who are working on content around this area, and so as you are asking questions, we are going to be gathering all of your questions that we don't get to and informing how we can continue to bring more information around those subject areas. And one of the ways that we want to do that right now is to just do a quick poll to see if there are some high priority areas that you would really like for the teams that are working on this content to bring you. So I'm going to bring up the poll. We're going to ask if you can quickly answer it just to inform the process so that we can continue to bring relevant webinars, training opportunities, resources to you. So you're going to see a poll come up on your screen. I'm going to launch it. If you can just answer it. If you don't see something that's a priority area to you, please click the other and add that area to the chat so that we can make sure that we have that information. So you should see a poll on your screen. I'm going to ask that if you can quickly answer the poll so that we can get to some of the questions that came up during the Q&A before we end the webinar. So the poll is up and live. I'm going to leave it up for a couple of minutes and try to get as much response as possible. And then we are going to address some of the Q&A that came up during the panelists. I will say, if we don't get to your question, please, please, please feel free to email or bring that up as a discussion on JDI Connect. We want to continue this discussion. We know that an hour is not enough time to really address every single thing that could come up or we want to talk about during a youth in custody webinar. So please feel free to start a discussion post on JDI Connect to see what your peers are doing or to ask the community for more resources. And we will continue to develop content based on the things that you've lifted up in this webinar in terms of questions. So I'm going to go ahead and close the poll. We have about 65% of the viewers because we only have about 7 minutes to answer some Q&As. So I'm going to end the poll. And I'm going to share the results briefly, and then we're going to go to the Q&A. So our results show that the highest priority is about maintaining programming. And so that really helps us as a team to really figure out where we can get examples of how that's being done throughout the network and really bring that to the larger community. And so, like I said, if there are things that we didn't see and that you want us to address, please feel free to put that in the chat as well and to email us at jdiconnect@pretrial.org so that we can continue to bring that up. So I'm going to pass it over to Jenny, who's going to bring up some of the questions that came up during the conversation. We won't be able to get to everyone's, but we want to lift a few up.
Thanks, Shavante. So there were quite a few questions, and I'm going to ask this as a two-part question to Angie and Tony. One of the issues was the cost. Is the cost for these extra video visits and maybe even medical care being passed on to kids and families? How are you managing that? And also just the fact that it's great that we're innovating with these kind of video court hearings and video access, but how do you guard against that kind of becoming the new normal? So are the costs passed along, and how do you kind of innovate without kind of taking away something in the future?
Okay, great. So In Calcasieu Parish, there's no cost associated to the video calls. Nothing is being assessed to the families. It's all, it's all equipment that we've already had, platforms that we've already had. We just asked them, if you have an iPhone and or an Android phone, if you didn't have the Duo app, to download it. So there's no cost to the families. And downloading the Teams or Zoom or WebEx app on your phone is free of charge. So there was no cost, no fees associated with that. In terms of the video conferencing and court becoming the new norm, there's going to be some need for video conferencing and video court, as well as times where attorneys and or mental health providers may have scheduling conflicts but just need to connect with a child in secure care quickly. So we'll be able to utilize those services at times like that. And if there is a quick need or emergency need for a court hearing, a juvenile judge can gather court reports, clerks, and prosecutors and everyone involved to get a court hearing up to date. We're not asking that our clinicians that are doing mental health visits, as well as our medical staff, to continue virtual virtual visits post-pandemic. Our medical staff is here on site 3 days a week anyway, and our clinician is here on site. So I don't think these things will become a new norm. If certain agencies or departments allow that to take place, then there's probably a reason for doing so, but I don't see it being a continued or sustained process in place of face-to-face visits.
And for us, the same. There's no cost being passed along for video visitation or for any medical costs being incurred while kids are in detention. Also, a couple things, and in video visitation, we really see that as just an addition to the options available to families. We're a very spread out community, geographically very large, and there are some limitations to public transportation here. So we just see this as making it more accessible for a lot of families. And a couple of things I wanted to highlight is it was really important to Tony and I to have that staff wellness bucket, because we acknowledge there are a lot added stressors going on for everybody, and that staff really have to be well, and we have to take care of staff for them to be their best and give their best to the kids. So we just really wanted to acknowledge the tireless efforts of detention staff and probation staff. So I wanted to just echo those comments. And here too, we also acknowledge that communities of color are being the greatest impacted by this crisis. And that's one of the focuses of the hygiene drive that we have. So we asked in the wish list that the items donated meet the diverse needs of the population that we have here in Pima County. So I just wanted to lift that up as well.
Just one quick question that came in, I think is important, given that we've been talking about a lot of Zoom and video conferencing with attorneys and family members. One question came in: how do you guys ensure privacy so that a young person feels both free to talk, but that safety is still ensured?
So that's a great question. In our detention center, we have we have several meeting rooms where kids can actually sit down in private and have a private conversation with their attorneys, and a detention staff member can actually be out in the hallway nearby them, or that kid can still be seen, through means of video camera. So we don't necessarily have to be in the room with the child. They're still on camera, and detention staff members in the hallway, so they're having a certain level of privacy with their attorney. And I know a lot of folks had concerns over the safety of Zoom and WebEx, and I think a lot of those hacks have taken place in terms of larger meetings where you might have 50, 60, or 100 participants on a call. I've not heard of any hacks into small conversations, one-on-one conversations.
Great, thanks. And I think we have time for maybe one more. Oh, do we not?
I don't think so, because we like to end these webinars right on time. But as I said, if we did not get to your question, we apologize. We really just wanted to start this conversation to bring a couple examples of what some jurisdictions are doing. We are going to continue to be working on developing more content for the network. Please feel free to reach out to myself on JDI Connect to to share what you want to hear from us. And this recording will be available within the next 24 hours to go back and watch. And we will take all of your information from the chats, the questions, and we will continue to formulate content to bring this to you. Please continue these conversations on JDI Connect. We really appreciate everyone joining us, and we look forward to continuing to work together to support youth and staff during this time. Thank you, everyone.
Thanks all.
Thanks,
everybody.